Cerebral aneurysms. Um, this is an abnormal weakening, thinning, dilation of the cerebral artery where it balloons out. Uh, Aneurysms are defined pretty much all the same way. It's just where their location happens to be, and that's in this case, the cerebral area. They often cause no symptoms and are not noticed until they start to leak or until they rupture. Um, they can be because of a congenital defect, from atherosclerosis, from hypertension, infection, medications, trauma. Um, they can occur in the brain, but um, uh, when the diagnosis is made, the treatment is to surgically repair the vessel. If it ruptures and it's too acute, then um, they cannot get the intervention done as quickly enough, then the brain damage may be the result. TIAs are a temporary episode of less than 24 hours of impaired function neurologically, and it is caused by a decrease in blood flow to part of the brain. May see them referred to as little strokes also. Um, they typically will recur. They can be seconds long or they can be hours long. Um, uh, Typically, they're given anticoagulants to lessen the frequency of the recurrences. Um, they may, as signs and symptoms, have sudden weakness, numbness down one side of the body, dizziness, difficulty speaking, confusion. Um, can't see from one eye, or loss of balance. And you can see these are pretty similar to stroke effect, um, except often not quite to the same degree. Um, and typically they don't last long term or cause as much damage. The most common cause is a piece of plaque that breaks away, travels to the brain, and it depends on where it lands or where it's located from there, um, uh, what happens with it from then. As in stroke, it has some similar risk factors, um, and those things that that a patient would have no control over, such as uh, family history, stroke, or age. But things like oral contraceptives may also increase the risk. So females taking oral contraceptives might be a little higher risk. Family members are also encouraged to be able to detect the signs and symptoms. Uh, Anticoagulant therapy may be used, and there's multiple different medications that might be used here. Um, Prognosis depends on the extent of the TIA and how long there is a reduced blood flow, oxygenated blood flow. Prevention, um, change those lifestyle factors that can be changeable, reduce the risk factors. Uh, Instructions given to what to do if the symptoms um, were to appear of an impending stroke. Epidural and subdural hematomas. This basically is uh, the location of the blood clot. So pressure on the brain results from either of them and can cause impaired function of the brain and possible death. Um, uh, Typically, these are caused by trauma with open head or closed head injury. So it's as simple as whether the skull is fractured or not fractured. Um, they're typically transported for emergency care quickly. In an epidural hematoma, there's a mass of blood between the skull and the dura mater. In a subdural hematoma, it's beneath the dura mater. So location there is the difference, and symptoms typically appear within a few hours of head trauma. Sometimes in sporting events, sometimes they will have the head trauma, and it may be an hour before you start noticing signs and symptoms. But sudden headache, dilated pupil, nausea, and vomiting, increased drowsiness, and it usually continues to escalate for a time period. trauma is the usual cause, um, and depends upon the area location that is involved as well. Upon examination, they'll have a history of recent head trauma, um, and in some cases, they may have to um, do surgically do a craniotomy, put what's called a burr hole in the skull to relieve the pressure because the brain's swelling. If they can't stop the bleeding, then it increases the hematoma will increase the pressure within the skull and causing damage to brain tissue. Um, so whenever the blood vessels rupture and seep around the layers, then blood on tissue is actually an irritant. So this irritates the brain tissue. If a person loses consciousness, then they need medical attention quickly. They're a patient not losing consciousness but has symptoms should still be seen quickly. Um, and then post-surgical instructions if they do have to have a surgical procedure for this. Cerebral concussion is bruising of cerebral tissue from the back and forth movement of an injury. Um, they may lose consciousness for a few minutes to several minutes, and then may have difficulty remembering things from 12 to 24 hours. Um, After they regain consciousness, a lot of times they'll have headaches or nausea, vomiting. They may have vision differences with everything from double vision to difficulty with blurred vision. Um, Anyone with a head injury should be seen quickly. Um, Complete a neurological exam. Um, they may have, if they get into respiratory changes, that's also concerning. Um, Muscle tone changes, that tells us the brain is actually being altered even more. Um, Usually it's from an impact with a blunt object, either a blow to the head or by falling from a distance, typically. Treatment bed rest and look for signs of behavioral changes. Um, Prognosis depends on the extent of the injury. One of the things that you might see with this would be some of the accidents, such as the ATV accidents and so forth. In cerebral contusion, when they're conscious, they may have severe headache. They may have uh, loss of feeling in one half. They may be drowsy, or they may be hyperactive, like hostile, and those kind of things. Now, it's caused from a blow to the head um, against a hard surface. So they need to be hospitalized, monitoring their vital signs, and intervening as needed medically. So they can have a number of signs and symptoms as well. Depressed skull is an injury kind of uh, break or fracture of the cranium. Symptoms basically a bone fragment pressing into the motor area of the brain. So it's basically a sunken skull fracture, so to speak. Signs include bleeding from the wound, ears, nose, eyes. Pupils may change. Um, Usually, direct impact with the skull from blunt objects is the cause. Treatment, craniotomy, and lift the bone that's depressed back up. And then they'll need head protection until that's healed to keep it from being re injured. In the spinal cord injuries, uh, we look at paraplegia here, and which is the loss of sensation below the waist, and so that'd be the legs and the lower part of the trunk. And then the quadriplegia is loss from the basically this is usually a neck injury, so this is the cervical neck. Um, and paralysis happens below that area to the arms, the legs, and the hands. When the spinal cord's injured, whatever part that comes below that from a spinal standpoint um, would have would be affected by that. Paraplegia symptoms are loss of movement and sensory control in the lower extremities and trunk. May also affect the bladder, the bowel, and the sexual function. In some cases, depending upon the injury, they may not lose the internal organ function, but a lot of them do. So, in symptoms of quadriplegia, the lower motor and sensory control in the upper and lower body, in other words, this one's from the neck down, so everything below that. They may have hypotension, they may have hyperthermia, they may have bradycardia, they may have respiratory problems because all of the area from the neck down can be affected. Paraplegia symptoms are loss of movement and sensory control in the lower extremities and trunk. May also affect the bladder, the bowel, and the sexual function. In some cases, depending upon the injury, they may not lose the internal organ function, but a lot of them do. So, in symptoms of quadriplegia, the lower motor and sensory control in the upper and lower body, in other words, this one's from the neck down, so everything below that. They may have hypotension, they may have hyperthermia, they may have bradycardia, they may have respiratory problems because all of the area from the neck down can be affected.